There is a diabetes epidemic in the world. If you watch this video till the end, maybe it will save your life or the life of somebody you already know. First of all, you need to do a test to know whether your blood sugar, your body is starting to lose control of regulating sugar. If you're above 25, you need to do this test. If you're above 25, you go to a lab and tell them you want to do, you see, A1C or HbA1c. All right. This one checks how your blood has been managing sugar in the past 3 months. This is the most important test that will tell you whether diabetes is around the corner. Usually, to be diagnosed of diabetes, it's a medical professional that will diagnose you after you've done all these tests and then. But this one is the best indicator. There's also fasting blood sugar. As you can see, there's a range. When you do it, the result should come out in a day or two. And if you are not within this range, if you're above this range, there's a problem. And then there's random blood sugar test. But this is the most important. All right. So, of course, when you get the test, you check. They will always give you their range. The laboratory will give you their range. So if you're above their range, that's when you have an issue. Then you can look for treatments. So many people are pre-diabetic. They are not diabetic yet, but their blood sugar is already, or their body is already approaching. So if you contain it then you are safe. You can bring it down, regulate it. But if you don't, and you don't know, so many people are diabetic. There's an epidemic of diabetes in the world. Many people are either diabetic already or pre-diabetic already. If you're above 25, go and do this test. It will save your life. Some people don't know that they have it until their legs start rotting or they have a wound that will not heal again. That's when they will now know. First of all, what is happening in Africa, especially in Nigeria, is when they have such a wound, they will say that they match poison. That's the language we use. They will now start accusing their neighbor of putting poison for them on the ground, or start accusing some people. They will start going to prayer house. Meanwhile, they are still eating what is causing it. They are still dumping more sugar in their blood that is causing it, until it will get into serious emergency before they will now go to hospital. So if you're watching this and you have a wound in your body that is not healing, go to hospital or let them check you. It's not a neighbor. It's not you didn't match any poison. No. Many people don't know that they are taking too much sugar. Every day they are going to work, they'll just buy one drink it. Buy one fruit drink on the road, or you buy this, you eat biscuits, eat cake, eat this, drink this one. Every day. If you do it for 1 year, guess what's going to happen in your body the next year? It shock you. As you are doing it, you are taking yourself closer to your grave. So go and check this now. It's one of the best things you can do for your life. Check this and see how it is. Now also, I want to encourage you to check it for your whole family, especially the elder ones. You know, dad, mom, husband, wife, brothers, aunties, uncles, as much as you can. Check it for all of them in a good laboratory. Many laboratories in Africa, they are giving fake results, so go to a very good one. All right. So usually, if your result is above 7%, you're already diabetic. From 6.5 to 7, depending on the lab, that's when you are pre-diabetic. You are already approaching. So usually, if you go to a hospital, doctor will recommend drugs that you can take to bring it down. But let's say that you want to try other things that are not regular. First off, here are things you should avoid. Even if you don't have diabetes, you should avoid this. You see, processed foods such as packaged snacks, packaged meat, you see, chips, granola bars, sweets, fast foods. These are the things that are taking you to your grave. Trans fat found in things like margarine, snack food, packaged baked goods, and many fried foods. Sugary drinks such as fruit juice, sports drinks, and soda. Every day you say you are going to the gym, you drink one certain thing every day. If you continue that for a long time. Now, some of these things, look at alcohol too. Some of these things, they are not really harmful if you take them once in a while. You know, if you drink something once in a while, there's really no problem. But if it has come into your daily routine, there's a problem, or weekly routine. You see? So if you find out that your sugar level is in danger, first of all, cut out all these things. Now, the thing with sugar is that it's actually addictive. Some people say it's even more addictive than cocaine. And you will not know that you're addicted. That's the problem. You don't know. So when you're addicted to sugar, it will be giving you imaginations of what to eat. And all those imaginations, we now call it craving. You're not craving for anything. No, now sugar, they talk inside your mind. Now, that craving, when you finally go and get the food you are craving for, you see that it's a bunch of sugar. Or it is starch or carbohydrates that will convert to sugar in your body. Do you understand? You will be dumping it in your body. After eating it, the next day, exactly around that time, you will start having that craving again. Even if you just finish eating, it will be as if the food did not really enter. You still need that craving. That is still need to dump that sugar inside your body before your body will relax. It's very addictive. So when you try to cut out this thing, you're going to struggle. I'm telling you. So the advice I usually give people is, if you are fully addicted or really addicted, you cut it out level by level. So let's say you normally drink 1 full cup of that sugary stuff. The next time you drink the next day you drink this, next day you drink this, you keep reducing it till one day you can cut off. Okay, let me show you. Before I tell you this, there are symptoms that will be happening to your body that will make you know that you are starting to have problem or diabetes is approaching. Number one is constant urination. Constant urination can mean a lot of things. So, but if you're experiencing this, go and see your doctor. Every normal human being is supposed to urinate like 4 times. If you drink a lot of liquid, 8 times per day. Somewhere between 4 to 8. Some people can even urinate just once, you know. But when diabetes is coming, you see yourself doing 15, 20 times per day. Every 1 hour. Every 1 hour. Every 1 hour in the bathroom, you are urinating. Every 1 hour. Before you do something at the office, you just get up to the bathroom, urinate, you come back. Before you do something. And these people, they can't really hold the urine. Once it comes, your body will start vibrating. You really need to. Sometimes you get to the bathroom and nothing will come out. Because you are empty, but the urge is there. Another thing is that once you urinate, immediately you start feeling thirsty. Immediately. So you will go and pick water and drink. Once you finish drinking and try to settle down to do something, bam, another urine. So your trip to the bathroom in a day, 16 times. Once you don't pass 8 times, there's a problem. Everybody's body is different, but generally, once you urinate, you feel thirsty, urinate, you feel thirsty, that's a sign that something is wrong. So you go for test and let a medical professional advise you. Maybe you're okay, maybe it's just the way your body works, who knows. So the next thing is some kind of discoloration on your neck, like kind of rashes, discoloration, a little dark area, like somebody rubbed something dark around your neck, and then some spots. If you see it, combined with this one I just said, Another one is fatigue. You really can't get through your day. You are just tired, getting out of bed, doing the, it's not normal to feel tired when you wake up in the morning. When you wake up, you're supposed to have energy. So if you're lacking energy, combined with all these things, go for tests. Many people are dying. This is what some people are saying, that unalived Mr. Ibu, a Nigerian veteran actor. Some people are saying, I don't know. So now, some people, when it comes to traditional medicine, some people suggest this. Discuss with your doctor. Say people with diabetes say it's been able to help them stabilize their blood sugar from a biochemistry standpoint. If you are eating only meat, you are largely not taking in glucose. Your blood glucose level would not be affected. So who knows? But some people are saying that switching to eating only meat for a month or 2 has helped them with that situation. Just meat and water. Meat and water. Meat you cooked yourself, because some of the meat you buy outside that is already cooked, you don't know what they use to cook it. Same thing with fish. Fish is also good, but then the fish you buy, you don't know whether they harvested it abroad and then they preserved it with some chemicals and shipped it to the country. Now when you're eating it, you're also eating chemicals. So as you're trying to cure one disease, another disease is coming. Same thing with chicken. You understand? You don't know what was used to raise the chicken. Some of this chicken, they pump in chemicals. So this is one of the diets that you can switch to based on your doctor's advice. When it comes to herbs, some people say that some herbs help. Look at this: ginger, goma, turmeric, garlic,